to recording device, and we are recording.
All right, good morning, everybody. Thank you for joining. Okay, today I'm actually going to talk to you all about, well, if I can get my screen to work here. Why is it not going? There we go. Sorry. Okay, I'm going to talk to you all about Medicare statements and claims tracking. Of course, Medicare statements consist of two different types of statements. The Medicare summary notice, which Medicare beneficiaries get if they are on original Medicare, or an explanation of benefits, and that's a statement they get if they're on an Advantage plan or they get it from their prescription drug plans. Of course, what these statements do, they explain, what healthcare provider or pharmacy sent the claims to Medicare, the amount that Medicare approved and paid, and how much the beneficiary may be billed for. Of course, understanding these claims is really, and actually looking at them, beneficiaries can actually spot fraud. So I highly encourage beneficiaries to actually read these statements when they get them in the mail. Of course, also another thing is I encourage beneficiaries to actually compare and contrast their Medicare summary notices to the bills that they receive. I tell them, do not pay anything until you get your summary notices and compare them with your statements from your doctors to make sure that they are billing you correctly. And another thing that I actually pass out to seniors is the personal health care journal, and this is where, they can keep track of their information, the doctors that they saw, the date that they saw them, if any tests were ordered or anything like that, so that they can keep track of all that, so that they might be, whenever you get their summary notice in the mail, that they might be able to say, hey, I didn't go see the doctor on that day, or, something like that. So keeping track of it's very, very important. Of course, Medicare summary notices, paper Medicare summary notices, only come out every quarter for the 3-month period usually prior to that. So beneficiaries have to wait to get them in the mail. But I highly encourage them, once they do get them, to look at them and compare bills before they ever pay anything. Of course, this is what the envelope looks like when they're mailing, when they get mailed out to the beneficiary. The envelope says, Center for Medicare and Medicaid Services. It'll have the address, and it'll say official Medicare information. So they know it's something coming from Medicare. On the back of the envelope, it says, if help regarding your notice, call 1-800-MEDICARE. If you change your address, contact the Social Security Administration. So, and it says to be opened by addressee only. So that's what the envelope looks like that the summary notices come in. Of course, in order to see their Medicare summary notices sooner, I highly encourage beneficiaries, if they can, to sign up for a mymedicare.gov account. They can actually see their claims in real time. They can actually print out their Medicare summary notices from that. They don't look exactly the same, but it pretty much gives all the same information. They can track their claims, check payment statuses, check their Part B deductible. They can actually look for, Part D plans on there if they want to. I highly encourage seniors to look at the mymedicare.gov to get those accounts. And this is a secure account. You have a username and password, so it's very secure. And so far, I haven't heard it being hacked into or anything like that. So Medicare must have it very, very, very secure, which is a good thing. So how do you read a Medicare summary notice? So this is, I usually go over this during our foundations training. A lot of people, of course, a lot of you volunteers have already seen what a summary notice looks like, but some surprisingly has not seen what one looks like. So how do you read a summary notice? There is two different types of Medicare summary notices. There's a Part A one, that's if they were ever in the hospital, and there's a Part B one, that's if, all the other medical doctors and providers and things like that. So there's two different types. So it's very important to look at the top to see which type of summary notice that they are getting. So here's what a Part A one looks like. As I said, at the top you will notice the first thing I tell beneficiaries to look at. Is it a Part A one or Part B one? Make sure your name is correct on there. Make sure, the other information is correct. The date of this notice is pretty much when it was printed. You have to look for, claims processed between, and that's the claims that the providers have actually sent to Medicare to be processed. Now, providers have up to a year to send their claims to Medicare. So not all doctors may process, their claims at the same time. Some may wait 6 months, some do it immediately. So it's just the dates are claims processed between. Another thing that I tell beneficiaries to look for is, your deductible status. Of course, I've had to remind some beneficiaries that yes, they do have deductibles they have to pay for before Medicare starts picking up. The Part A one, especially a lot of beneficiaries don't realize there's a Part A deductible, of course, and the Part B one. And next thing I tell beneficiaries to look at is where it says, did Medicare approve all the claims, yes or no? So that's up here on the right-hand side of the very first page that they get, that did Medicare approve all these claims. And another thing I have to remind beneficiaries, especially on the right-hand side, it explains this is not a bill. So I've had to explain that to a lot of beneficiaries, especially if they're QMBs, because they'll think that they owe something when down there in the notes it'll say that, the remaining balance was sent to Medicaid. But so another thing, look, did Medicare approve all the claims? If they did not, then we need to find out why, Medicare didn't approve all the claims. And then down here under that, it'll have, facilities with claims this period. So it'll have all the providers listed there with the date or dates. So they need to check those also. So that's what page 1 looks like of a Medicare summary notice. So page 2 is more a lot of information, how to check the notice, how to report fraud, how to get help with your questions. Of course, SHIPS numbers will be there. It has if it's a Part A notice, it'll have your benefit periods. And y'all remember what a benefit period is? I hope you do. Of course, that's taught during our two-day initial volunteer training. A benefit period starts when a beneficiary goes into the hospital, and it does not stop until they come out of that facility. But actually, the benefit period doesn't stop until after 60 days after that. So if they go back into the hospital within that 60 days, they're still, after they get out, they're still in their same benefit period. A new benefit period does not start until they have not been in the hospital or a facility for 60 days. So that is a benefit period. So here it'll tell you how many, days was covered for their benefit period. It says inpatient hospital or skilled nursing. It says it'll have, you have so many days left of your covered benefit days remaining for your benefit period. So that's another good thing for seniors to look at, especially if they are in and out of the hospital a lot. And then after that, after the benefit period, just some messages, kind of remind them to get their flu shot or anything like that. So any preventive stuff they usually stick in there. So, and of course, the two different claims, the Part A and Part B, Part A ones you will see like wording like facility and things like that. under a Part B one, you will mainly see, like a provider or something like that. So that's another reason you can tell Part A's from Part B's. So here's another thing. This is actually page 3 of Medicare Summary Notice, Part A Medicare Summary Notice. And there can be multiple page 3s. So just thought I'd let you know, because it depends on how many times they're in the hospital during that time period, or especially if it's a Part B one, it's how many times they go to the doctor. Some go monthly, or several different doctors in a month. So they can be quite lengthy. So there can be multiple page 3s. So again, they need to look at the top. Is it Part A or Part B? Read the definitions in the columns. It says, definitions of the columns, and they'll explain what each of these columns down here are for. So the other thing that they need to look at, make sure the dates of the claim were under number 3. Make sure the dates are correct. Make sure the hospital is correct. Now, keep in mind, there are some community hospitals that's owned by these larger corporations. So it may have, for example, St. Thomas owns several community hospitals. TriStar owns several. So they may actually have, like St. Thomas in there. Or, it'll have the corporation name. It may not have the actual hospital name. So just keep that in mind when you're looking at these. So it'll have, down at below the dates in the hospital, it'll have, benefits period, and then it'll have benefit days used. Was the claim approved, yes or no? The non-covered charges. Amount Medicare paid, so that's how much Medicare actually paid the hospital, and maximum you may be billed. Of course, here it's 0. And I highly encourage seniors, when they're looking at these, or if you're looking at these, to read the notes. If there's like a letter beside the maximum you may be billed, where it says see notes below, please read those notes, because those may be beneficial, to something. Usually they put in there, especially if they have a supplement or QMB or something like that, it'll have in there that the remaining balance was being sent to either Medicaid or their supplement or anything like that. So, or if it was denied, if this claim approved was a no, it'll have down here, why it was denied. So that might give a reason as to, where you need to go next to help a beneficiary. So if there is a no in this claim approved, and the beneficiary thinks Medicare should pay for it, then page 4 is where you need, or the very last page is the page that you need to look for, because this is, if they think Medicare should pay for it, then this is how you help them file an appeal if you need to. And another thing to look for on this very last page is Medicare has to have an appeal in writing by a certain date, or they will not hear the appeal. And that date is on the very last page under number 2. It says if you do disagree with the coverage decision, payment decision, or payment amount on this notice, you can appeal. And this, it says we must receive your appeal by, and there's a date there. That is a very important date. That is usually 20 days out from the date of the notice that's on the very first page. It's usually 120 days out. So that's the date that Medicare has to receive this appeal by if Medicare denied something. Very important date. So if it's past that date, then Medicare does not have to look at the appeal at all. So that's why I highly encourage beneficiaries, please read your Medicare summary notices, because if they don't look at them and Medicare's denied something and then they haven't looked at them for 6 months, then they decide to finally go through their stack of mail, it could be past this date. And if it is, they may be having to pay for, something that they don't need to be paying for. So that's why I highly encourage beneficiaries, please look at your mail. So if you need to help a beneficiary file an appeal, look for this last page. And here on the right-hand side is the steps that you need to take to help them file the appeal. So you have to go back through, to page 3 or whatever page the service is on that was denied. Circle that service and then explain in writing. And usually I do, when I'm helping someone file an appeal, the explain in writing, I usually, have them with me and I'm typing it out, so it's legible, or if they've got really good handwriting, then, have them, write something out as to, why you think Medicare should pay for it. And you may have to back up some of that with other documentation, like from the doctors or anything like that. So next thing to do is, number 3, fill in all the information that's and this is printed, the beneficiary's name, they have to actually sign it, their telephone number, and their complete Medicare number. So nothing is include any other information. So if you get anything else like doctor's notes or anything that would help as to why Medicare may have denied that claim, supporting for them to pay it is very helpful. I helped a gentleman do an appeal regarding a CPAP machine. Medicare had denied it, and Medicare denied it based on the provider did not date stamp when they got the prescription from the physician. So when I sat down with him and helped him do the appeal, we provided pretty much every type of documentation we could. We provided, because you have to have a sleep study, I provided the sleep study, the date it was done, and the results of it. The notes from his doctor when he met with his doctor, and the doctor wrote his prescription. A copy of the prescription that was dated by the doctor. Pretty much everything, and even the documentation from the DME provider regarding when they got the prescription, everything like that. So I provided all sorts of documentation, and he did finally win his appeal. Of course, it had to go all the way up to the administrative law judge, but he did win his appeal, and it's because we had all that documentation already. So as much documentation that you can get to back up why Medicare should pay for this is very helpful. Another thing was that you have to write their Medicare number on every sheet of paper that you're sending. And another thing is make a copy of everything that you're mailing. And then, of course, step number 7 is this is the address that you will need to send the appeal to. So please make sure that, you're mailing it before this date up here in number 2. So that's pretty much how you file an appeal. So here's what a Part B one looks like. It's very, very similar to a Part A. So I tell beneficiaries, please make sure you look at these. Is it an A or a B? For example, I had a gentleman, and some of you probably already heard this, where he went for an outpatient colonoscopy, but he got a Medicare Part A summary notice in the mail for a hospital bed, an inpatient hospital bed, but he was never actually inpatient. So that's why, I highly encourage, beneficiaries, please read your Medicare summary notice. And that's what I need you all to do if you're out there talking to beneficiaries. Encourage them to read their summary notices. So here's a Part B one. So pretty much very, very similar to Part A one. They'll have their deductible status and the claims and the cost period. Did Medicare approve all the services? In this one, it says a no. So we'll have to, determine why Medicare denied it. It says number of services Medicare denied. It was no. And then this is the total that you may be billed. And here is the name of the provider. Of course, this could have a very long list, and it could be multiple pages. Depends on how many times they actually go to the doctor. So, of course, page 2, pretty much a lot of the information. And so, and you can tell a Part A one as a Part B one from it'll have the words like doctor or provider or something like that instead of facility. So this is what a page 3 looks like of a Medicare Part B. So what things to look for here, of course, is, definitions. Highly encourage you to read the definitions. The date of the service is number 3, so look to see if that's correct. This is the physician that you've seen. Now, sometimes if you have seen a is it licensed nurse practitioner, and they're under a doctor, it may have the actual doctor's name up there, not the actual nurse practitioner that they saw. It's because they're operating under that doctor's license. So keep that in mind. So if they've seen somebody else in the office, it may be that the actual doctor's name up there, not the actual person that they saw at that office. So I have to tell beneficiaries that also. So it's because they're going by the doctor's license that they're working under. And then I'll have the address. I said, some doctors work for these bigger corporations, or they have several doctors have gone into, one little business. So the address may not be the same doctor's office. It may be their corporate address up there. So another thing to look for is, the service. Is this the actual service that they received? This is number 4. Is this the actual service you actually received? Was it approved, yes or no? The amount provider charged, the amount Medicare approved, amount Medicare paid. Now, the amount Medicare approved and amount Medicare paid are different. Do y'all know why? Well, y'all, she's got y'all muted. I'll tell you why. It's because that 20%. Medicare only covers 80%. So that's why there's a difference between, Medicare approved amount and Medicare paid amount. It's that 20%. Of course, the maximum you may be billed is that 20%. So if the amount Medicare paid and the amount you may be billed do not add up to a Medicare approved amount, then there's something wrong in there. So we'll have to call Medicare and figure out why is there a difference, because the maximum you may bill is that 20%. So, of course, in this one, Medicare denied something. It's description of skin growth. It was denied. So amount provider charged was $68.56. So that's why this $68.56 is actually in this column. It says maximum you may be billed because Medicare denied it. And then there's a note right beside it, A. It says this service was denied. The information provided does not support the need for this service or item. So Medicare did not think this was medically necessary. So something, and this could go back to the doctor did not do very good documentation as to why this was medically necessary. Medicare usually denies stuff unless it is medically necessary, and the doctors have to document that it was medically necessary for Medicare to pay for it. And also you'll see down here under C notes, there's a B. And it says your claim was sent to your Medicare supplement insurance, Medigap policy. And then it names the policy, Wellmark Blue Cross Blue Shield of North Carolina. So if they've sent it on to what you might owe, if they've sent it on to your Medigap policy. Of course, if Medicare has denied it, your Medigap policy will most likely not pay it either. So keep that in mind when you're speaking to a beneficiary. So it's very important for you to read the notes and make sure everything adds up. Now, where Medicare gets these, Medicare approved amount and things like that, it's from those contracts that they negotiate with the doctors that, they're only going to pay them, this certain amount for this certain type of service. So those are actually contracted amounts. And, of course, if a doctor does not take Medicare assignment, they can actually charge Medicare or the beneficiary more money. So that will So that's why if you're seeing something different than, what you've seen before or something, that could be because the doctor did not take Medicare assignment. So, of course, page 4 or the very last page, same thing, file an appeal. Need to look for the date there in number 2 as to when Medicare needs to receive the appeal by. Same thing as filing an appeal for a Part B as you do for a Part A. So just, circle the service that they disagree with. If there's any documentation they could have gotten back from the doctor, especially this discretion and skin growth, if there's any more documentation from the doctor they could get to go along with the appeal, the better. So that's pretty much how you file an appeal and pretty much how you read a Medicare summary notice. So also, I was going to tell you, Medicare is actually reinstating the qualified Medicare beneficiary indicator in the Medicare fee-for-service claims. I know they had started that. Then they stopped it back in October. But they're actually supposed to start reinstate that starting July 1st of this year, which pretty much means it lets them know that that a QMB cannot be balance billed for any cost sharing. So I think it'll help a lot of hopefully for this balance billing when they get this started back up. Hopefully, it will cut down on a lot of that balance billing issues. So as I said, they're supposed to start this July 1st and this is for claims processed on or after July 2nd. So anything that's after July 2nd should be indicated on the Medicare summary notice that they're a QMB and are not subject to the balance billing. I'm hoping it's gonna work this time, and they're not gonna have to back out of that again. So, so pretty much that's reading a Medicare summary notice in a nutshell. I just have to highly encourage beneficiaries to actually read them, or if they have any questions about something, to bring them to us. Volunteer. SHIP. Call us. Bring it up to us. Something, if they have issues or they have questions or anything, just to let us know. So when you're talking to beneficiaries, please encourage them to read their summary notices. So I'm open for questions now. Does anybody have any questions?
We had a couple questions come in through the chat, so we'll address those first.
Okay.
So the first one, and you may want to go back to the slide that references this.
Okay.
The first question is, how do you know what they should or shouldn't pay for? So how does the beneficiary know what they're responsible for?
Okay, so for example, like in the page 3, it'll say, the maximum you may be billed. That's pretty much what the beneficiary is responsible for unless they have, for example, if they have a supplement or if they have the QMB. So that should be in there as to how much exactly they owe, where it says maximum you may be billed in that column right there.
Great. And another question that came in is, can appeals be faxed or only mailed?
I think they can be faxed if you get the fax number from the Medicare contractor that handles the appeals. But you would have to call them and actually get the fax number.
Great. We had one comment come in that I think is good to share, and you may have said this as well, Lonnie. But it says, I have found sometimes it's quicker to call the doctor to see why the claim was denied and see if they can correct it first, maybe a human error or wrong code on accident, something along those lines.
That is correct. Most of the time if something is denied, the doctor has already appealed it, because the doctor can appeal it also, or the provider can appeal it also. So the very first thing I would one, call the doctor's office, because one, they can either, provide more documentation, and get it corrected that way, or they can appeal it and, provide more documentation. So I would definitely talk to your doctor first. It could be a number of reasons. Wrong code, didn't provide enough documentation. Sometimes, just ask the doctor, tell them, hey, Medicare denied this. Can you appeal, can you appeal it? And most doctors' offices are more than happy to appeal it. And I've actually had some where the doctor's office appealed it and the beneficiary appealed it all at the same time. So,
great. We did have another question come in. If the deductible has not been met, how is it reflected on the MSN? Does it show in the you may be billed column and then a note? Or how is that shown?
Yes, that is, it'll show in the maximum may be billed, and it'll say down, there'll be a note that you have not, or this amount will be applied to your deductible. That is one of the notes. And I think that's under Part A, for example. Well, this one, for example, like number B. This amount was applied to your skilled nursing facility coinsurance. So the other one, it'll have a note that this amount will be applied to your Part B deductible or your Part A deductible.
Lonnie, I think we had a lot of feedback, and I had to mute some people who unmuted themselves. You may want to say that over again.
Okay. Yeah, I heard that also.
Sorry.
Yes, it will have a note down at the bottom where it says your deductible or your this amount will be applied to your Part A or Part B deductible. That will be a note down at the bottom.
Great. Thank you. Sorry about that, everybody. We had another question come in. Does Medicare normally pay for sleep studies and bone density studies?
Well, Medicare only pays for a sleep study if there's certain diagnosis, or to get a certain diagnosis. Of course, it does have to be, doctor has to prescribe it. And, backup documentation has to be provided with that as to, why the sleep study is needed. So what was the other one? Sleep study and...
The other one is bone density study.
Bone density. Is that a bone density test or a bone density study?
It says study. I know bone density is a preventative service. It's a screening.
Yes, I thought the bone density test is a preventive services, which usually are paid at 100%. Now, the bone density study, I'm not quite sure about.
Okay. I've actually.
I don't know if that's two separate things or if that's the same thing that they were asking about.
Yeah, I'm looking up on Medicare.gov, and it says for bone mass measurement or bone density, Medicare Part B covers this test once every 24 months for people who meet the criteria. This test may be covered more often if it's medically necessary. Who's eligible? All qualified people with Part B who are at risk of osteoporosis and meet one or more of these conditions. A woman whose doctor determines both of these, she's estrogen deficient, she is high risk of osteoporosis. A person whose x-ray shows possible osteoporosis, osteopenia, and vertebrae fractures. A person taking these are big words, guys. Prednisone or steroid-type drugs, or is planning to begin this treatment. A person who has been diagnosed with primary hyperparathyroidism. Where's the nurses? Come on.
Okay, yeah, they have to have several reasons why.
And same thing with a sleep study according to Medicare. Medicare Part B covers type 1, 2, 3, 4, or 1, 2, 3, and 4 sleep tests and devices. Medicare only covers type 1 tests if they are done in a sleep lab facility.
Yes.
Okay, and those are all of Those are all the chat questions.
Okay.
So if you, I don't want to unmute everyone's line because we know that kind of went bonkers last time. So if
we
you have a question,
raise your hand. Do we have that?
We do. If anyone knows, if you go highlight your name, there should be a little hand that you can raise and I can unmute your line, or you can try and talk and see if your line's unmuted because you listened to directions and you muted your line before the webinar starts. All right. I don't see any hands raised. So I think what I'll do is I'll stop the recording if that's okay with you, Lonnie, if you want to go over that last slide real quick.
Okay. Now, please, we ask that you do the survey after you click out of the webinar. It'll ask you if you want to do a survey. Please, we ask that you please do these surveys so Sydney and I can get feedback from these. If you have any suggestions on topics or please, let us know what you think so that, we can better ourselves or, change things if we need to. Just please fill out the survey for us. We'd really appreciate that. And I think Sydney will be emailing also the link in an email.
Yes,
so that
definitely.
you can fill it out that way.
Yeah, I'll have the follow-up email with the survey the link to the survey and the follow-up email, as well as this link is in the materials that I emailed to everyone yesterday if you wanted to do it before I was able to get the email out to everybody. This webinar will be posted this afternoon as well. I know some of you have messaged that you came in a little bit later, so if you're wanting to know more of the context of what we talked about before you were able to join us, hopefully shortly after lunch, if not before, I will have this webinar posted to our Tennessee SHIPSMP YouTube channel, so you can have that for references in the future if you're needing it. But with that, I don't see any hands raised, so I'm going to stop the recording.